friends, welcome back to the channel. Today I will clarify important medical facts about three mosquito-borne diseases: malaria, dengue and chikungunya. As this is the peak season for the spread of these diseases, that is towards the end of the monsoon or just after that, these illnesses cause confusion and fear among the people, so understanding them scientifically is essential. I will also debunk some myths that we hear regularly about these diseases. So let's get started. First is malaria. Malaria is caused by a parasite called Plasmodium, which is in itself transmitted by female Anopheles mosquitoes. The parasite infects our RBCs or red blood cells, causing high fever, chills, sweating, headache, and fatigue. Severe cases can lead to anemia or cerebral malaria requiring urgent medical treatment. Diagnosis is done by rapid malarial card test detecting the parasite. Artemisinin-based combination therapies remain the recommended treatment. Delayed treatment can be fatal sometimes. So, let's debunk some myths regarding malaria. Malaria is just a fever and can be treated with paracetamol alone. The fact is, specific anti-malaria drugs are necessary to treat malaria. Paracetamol only reduces fever and doesn't kill the parasite. Second myth, malaria is of one type only, means all malaria are same. The fact is, malaria is caused by 5 different species of Plasmodium, of which in India there are only 4 species as of now. Each of them have slightly different symptoms and different treatment is required as the species is different. Second disease is dengue. Dengue virus is transmitted by Aedes aegypti mosquitoes that bite mostly during the day. Symptoms include sudden high fever, severe joint and muscle pain, headache and rash. Severe infections may cause bleeding, organ impairment or shock. No specific antiviral exists for dengue. Treatment is supportive, focusing on hydration and symptom management. Also, taking NSAIDs, that is non-steroidal anti-inflammatory drugs like Brufen, Combiflam, Meftal, is strictly prohibited in dengue as it may further reduce the platelet count and cause further complications. Only and only paracetamol is to be used to subside the fever with additional support with cold sponging as a supplemental method. So let's debunk some myths about dengue. First myth is antibiotics cure dengue. Fact is that dengue is a viral disease. Antibiotics do not help unless a secondary bacterial infection occurs or is suspected. Second myth, having dengue once protects forever. The fact is immunity is serotype based. Serotype specific. There are 4 dengue serotypes. Infection with one does not prevent infection by others. Rather, once you get infection, you are susceptible to more severe infection. Third myth is that papaya leaf or papaya seed extract increases the platelet count in dengue. The medical evidence supports that platelet count do not increase using these remedies. There are no scientific data which can prove this, and medical supervision is essential. Third disease is chikungunya. Chikungunya virus is transmitted by Aedes mosquitoes and presents with high fever, rash and severe joint pain that may persist for weeks or months. Most patients recover fully with supportive care. That is, it is mostly non-fatal disease. Myth: chikungunya causes permanent disability. No, the long-lasting joint pain is common, but permanent disability is rare. Second myth is chikungunya and dengue are the same diseases. Fact is that they are caused by different viruses and are completely different diseases and diagnosed with distinct tests. Yeah, the symptoms may overlap, but the diseases are different. Myth: steroids should be used for chikungunya related pain. Fact: steroids are not routinely recommended and may cause harm instead of cure. Symptom management typically uses non-steroidal anti-inflammatory drugs and rest for such patients. Some additional common misconceptions include home remedies like neem or herbal drinks prevent or cure these infections. No, These remedies have no scientific backing and do not replace validated medical therapies and preventive actions. Second misconception is that mosquito fogging alone is sufficient for control of such diseases. No, fogging affects adult mosquitoes temporarily but does not eliminate larvae or breeding sites, which must be addressed to reduce the disease spread. Third is that severe illnesses only affects children or elderly. The fact is that severe disease can occur at any age, specifically dengue. Anyone experiencing symptoms requires timely medical evaluation. Summary: early diagnosis, proper treatment, and prevention through mosquito control and protective measures saves lives. Avoid self-medication and seek medical care promptly if high fever, rash, or prolonged joint pain occur in endemic areas. Uh, Thank you for your attention to this important health information. Stay safe and informed.